Welcome to This is UIC Weekly, bringing you the top stories you need to know from the University of Illinois Chicago each week. It's Friday, October 31st. Here's the latest.
The Sahara Desert is one of the driest areas in the world. It gets just 3 inches of precipitation per year. That's 1/10 of what Chicago receives. But by the second half of the 21st century, rising global temperatures could make the Sahara much rainier, according to a new study from UIC researchers. By that time, the North African desert could see 75% more precipitation than its historical norm. Under extreme climate conditions, rainfall may increase in southeastern and south-central Africa, too. Lead study author Thierry Taguela said understanding how rising temperatures affect rainfall can help in developing strategies to adapt to those changes. The UIC researchers published their findings in the journal NPJ Climate and Atmospheric Science.
With the help of a new federal grant, researchers at the University of Illinois Chicago aim to make cities across the country more accessible for people with disabilities. The 3-year grant is funded by the National Institute on Disability, Independent Living, and Rehabilitation Research. It will enable College of Applied Health Sciences researchers to develop tools and resources for urban planners and ADA coordinators, improving city planning decisions and accessibility and better involving people with disabilities. The researchers will create 2 separate toolkits, one for city planners and ADA coordinators, and another for people with disabilities. The goal is to make these resources highly usable and accessible so cities can more effectively implement the changes needed and incorporate input from people with disabilities in city planning. Yochai Eisenberg, Associate Professor in the Department of Disability and Human Development, said the toolkits will help to create a safer environment for everyone.
These plans are intended to improve that infrastructure and support, essentially safe walking and wheeling among everybody. And a lot of the times when there are ADA improvements, those improvements help everyone.
UIC, UI Health, and Cook County Health are building on their existing pediatric care collaboration launched in 2021. Their new expanded public-public partnership will bring together clinical care, medical education, and research to better serve patients and communities, especially during this time of uncertainty in the healthcare landscape, with shifting healthcare policies and budget cuts. Medical students at the University of Illinois College of Medicine will gain broader access to training and clerkships at Cook County Health, while staff from both institutions will benefit from shared resources and leadership development opportunities. The partnership spans more than 16 clinical specialties, including oncology, pediatrics, and neuroscience, with a focus on cost-effective care and expanded access to enrollment in clinical trials. And with a focus on research, both institutions will amplify their global impact, mentor emerging researchers, and enroll more patients in joint research studies.
UIC is Chicago's public research institution with a mission to provide the broadest access to the highest levels of research, educational, and clinical excellence. Visit today.uic.edu for these stories and more.